Hi guys, we're back again with my YouTube site 101 or Mastectomy 101. So I'm going to deviate a little bit from my plan, and I've been getting a lot of feedback with people asking, what should I ask my doctor? And I've kind of changed and improved and annotated my initial list that I had when I went to the doctor myself. And I always suggest that you bring someone along. And it's always best to maybe even bring a third person along if your spouse or your significant other is the one that is your second witness, because they're emotionally involved too with this whole process. And if you bring a third person who's more objective to the situation, they can take the notes, and then because I promise you, your head will be spinning in a million directions and you won't remember most of it. So the first thing that you should ask is my breast cancer invasive? And what that means is, has the cancer invaded the local tissue? Has the ductal cancer escaped from the ducts and spread to the breast tissue? Has the lobular cancer escaped the lobules and invaded the nearby breast tissue? And that's why it's called invasive cancer, if that's the case. So the second thing is, what is my lymph node status? And this, of course, is all post-surgery. So the more lymph nodes involved is the probability that the cancer had started to spread. Hopefully will be able to find a negative node during surgery, but that is very important with your treatment plan. Secondly, I'm going down the list. The next thing is, how large is my tumor? So when you have your pre-surgery diagnostic testing, they will give you an idea from whatever scans you've had to how big the tumor is. But there really is no way of knowing until you actually have the mastectomy and they do cross sections of all the tissues that they take. So, and that again will go into your staging. Now, the things I'm going to talk about today, I have a podcast. It's Sisters for Prevention Breast Cancer Resource Podcast. There's a lot of information there about staging and tumor grade, and also on my website, www.sistersforprevention.com. If you follow me on YouTube, I will eventually cover those topics, but I want to say, if you're sort of anxious to hear about them, you do have those resources to you. So besides how large the tumor is, there is something considered a grade. So the grade is really, how do the cells look? Do some of them still resemble normal tissues, or are the cancer cells totally look like rogue cells? Like, if the closer they look to a cell that has a defined nucleus and isn't just a big blob on a screen, then that's better. It's called differentiation. And what differentiation is, the grade of that is, how different do your cells look than normal cells? And that's really, really important, because it means that the cancer hasn't yet become totally out of control. So the more your cancer looks like a regular cell, the lower the grade, and the better usually for the outcome. So then we talk about the Oncotype test. And again, this is all post-surgery. So the Oncotype test is a test that they have sampled about 30 breast cancer cell genes, and they look at how many of these your tumor tested positive for. And again, I'm going to cover this in a future podcast, and actually I covered it in a podcast, and I'll be covering it in a future YouTube video. But if you are in the lower range of the, I believe it's 18, then you will not need chemotherapy, or your tumor does not respond. If you're slightly over, then you're in the gray zone. If you're in the high end, up near 30, then normally chemotherapy is prescribed. And again, the other important things to know is, did my tumor respond to the hormones estrogen and progesterone? And does my tumor express HER2? HER2 is a protein that is expressed by highly aggressive breast cancers that now, thank goodness, we have Herceptin to combat this type of cancer. And that would be what you would be having as part of your chemotherapy. And that chemotherapy with HER2, with Herceptin, and now they have other drugs similar to Herceptin, that would last a year, every 3 weeks for a year. And the last thing, or some of the last things, is how quickly do you think my cancer was growing? Now, that again goes back to differentiation. How abnormal have my cells become? When cancer cells are young, they resemble normal cells, and as they get more aggressive and divide and divide and divide, the more they divide, the more they become different, and they can tell the aggressiveness of the cancer, as well as by including the lymph node status. And then the big question we all want to know is, will I have further testing to determine if my cancer has metastasized? Now, these are the questions you ask your surgeon. The only way to find that out would be to follow up with a PET scan, and this is all dependent on your status, your lymph node status, your tumor grade, and tumor size. And this all goes into the equation. But having all this information helps you to make decisions on what the best pathway to go in is. And what are the chances of my having a recurrence? And the best way to find this out is to talk to your surgeon. Don't go on the internet because there's a lot of misinformation or disinformation out there, and you always want to be careful about that. Now, something that I learned of recently, which I never heard of, is that you can actually get a second opinion on your pathology report. Now, someone that I know had actually been diagnosed that they did not have cancer, and when they sought a second opinion for another pathologist to look at it, they indeed did have cancer. And this goes back to my first YouTube video where I said, go to a cancer center, a breast cancer center. I wanted to know that everyone who was looking at my pathology, that was their job. They were only looking all day long in their job at breast cancer pathology, because I was sure that they were the most qualified to make that decision. If you're at a local hospital, that might be a good thing for you to do, is to go and get a second opinion on your pathology. And then always get a copy of your pathology report and all your testing, because even though you have someone taking notes for you, it's really helpful to have a copy of that report. And so you can look back and remember why you made the decisions that you did at the time. And that's really important for psychological survival and not second guessing why you made the decisions that you did. So I'm going to end it here. Please feel free to comment and ask me questions. And again, please use my website, www.sisters4prevention.com, for a resource for you. And check out my podcast. You can get the link to both of these actually on my home screen of YouTube. And that's Sisters for Prevention Breast Cancer Resource Podcast. So, thanks for being with me. And till next time, stay safe, stay healthy, and God bless. See you next time.